Hi there viewers. In this video we are going to talk about, do children still get measles? But before that, take some time to hit that subscribe button if you haven't yet. Okay, let's get into the topic. Do children still get measles? Unfortunately, yes. Measles is an extremely contagious and potentially deadly viral illness. Any child who has not received the measles, mumps, and rubella (MMR) vaccine or the MMRV vaccine, a combination of the MMR and varicella, or chickenpox vaccine, is susceptible to catching the disease. From January 1 to May 17, 2019, there were 880 confirmed cases of measles in the United States. This includes 24 states and is the greatest number of cases reported in the United States since 1994. This outbreak was caused primarily by unvaccinated travelers who became infected with measles while visiting countries where measles is widespread. When they returned to the United States, they exposed unvaccinated people in their area to the virus. Other contributors to the outbreak are groups of people who decided not to vaccinate, for religious reasons or based on misinformation about the safety and effectiveness of the MMR vaccine. Before the measles vaccine was introduced in 1963, about 3 to 4 million people in the United States were infected with the disease each year. Of those, 48,000 were hospitalized, and 400 to 500 died. After the vaccine program began, the number of measles cases was reduced by 99%. Even so, measles outbreaks still occurred in this country. Between 1989 and 1991, for example, 55,000 cases of measles were reported, with 123 deaths. These were mostly unvaccinated preschool children in urban areas. In 2000, measles was considered eliminated from the United States, but then the numbers began to creep back up. In 2011, 220 cases of measles were reported, and in 2014, 667 cases were reported. From 2015 through 2018, 766 people in the United States came down with the illness. Most of those infected had traveled to foreign countries or lived in communities with pockets of unvaccinated people. Measles still occurs all over the world. According to the World Health Organization, an estimated 7 million people worldwide were affected by measles in 2016. And more than 95% of measles deaths occur in countries with low incomes and weak healthcare systems. What causes measles? Measles is caused by a type of virus called a paramyxovirus, and it's very contagious. When someone who has the virus sneezes or coughs, tiny droplets containing the virus spray into the air. The droplets stay active for 2 hours in the air or on a surface. A child who breathes in these droplets or comes in contact with them can become infected. If your child isn't immunized and he hasn't already had the disease, he has a 90% chance of getting infected if he's been exposed to the virus. Someone with measles is contagious for 4 days before and 4 days after developing the telltale rash. What are the symptoms of measles? After a child has been infected, the first signs of measles will appear in about a week to 12 days and usually involve cold-like symptoms. Fever. An extremely runny nose. Cough. Red, runny eyes. Low energy. Poor appetite. A few days later, she may develop characteristic spots in her mouth, particularly on the mucous membranes that line her cheeks. These spots, called Koplik spots, appear as tiny white dots like grains of salt or sand on reddish bumps. A couple of days after that, a measles rash appears on the child's face at the hairline. It then spreads downward to the neck, back, and trunk, then to her arms and hands, and finally to her legs and feet. The rash starts out as flat red patches but eventually develops some bumps. As the rash appears, the fever usually climbs, sometimes reaching as high as 105 degrees Fahrenheit. The rash may be itchy. A child with measles may also develop croup, nausea, vomiting, or multiple swollen lymph nodes. The cough may become troublesome, and the child will feel miserable. The rash usually lasts about 5 days, and as it fades, it turns a brownish color. It fades in the order it appeared on the child's body and leaves the skin dry and flaky. Most children have symptoms for about 1 to 3 weeks. What are the possible complications? Otherwise healthy children usually recover from measles just fine, but about 30% of people with measles develop one or more complications. Complications are more likely in children younger than 5 years old, pregnant women, adults age 20 and older, and those with compromised immune systems. According to the Centers for Disease Control and Prevention, CDC, for every 1,000 children who get measles, 1 or 2 will die from it. Complications include ear infections, which can result in permanent hearing loss, diarrhea, pneumonia, which is the main cause of death from measles in young children, affecting as many as 1 in 20 children with measles encephalitis, which is a swelling of the brain that can result in deafness or intellectual disability, affecting about 1 in 1,000 children with measles. In addition, in pregnant women, measles can cause miscarriage, premature birth, or a low birth weight baby. What should I do if my child has been exposed to measles? If your child has just been exposed to the measles virus and has been fully immunized, received 2 doses of the MMR vaccine, it's extremely unlikely that he'll come down with the measles. Still, contact his doctor if he develops symptoms. Talk with the doctor if your child has been exposed to the virus but has only had 1 out of 2 MMR shots. If he had the first shot after his first birthday and it was 1 or more months ago, the doctor may give him the second shot right away, for added protection. Some states will still require another dose after a child's 4-year birthday, if the second dose was given before then. If your child has been exposed but hasn't yet been immunized, call his doctor. If it's been 6 days or fewer since exposure, the doctor may suggest an immune globulin injection to help prevent measles from developing or at least make the symptoms less severe if they do show up. If your child is 6 months old or older and it's within 72 hours of exposure, the doctor may also recommend 1 dose of the MMR vaccine. He'll still need to receive 2 more doses of the vaccine on the recommended schedule, at 12 to 15 months and another at 4 to 6 years. How should I care for a child with measles? If you suspect that your child has measles, call her doctor right away. Don't go to the office or emergency room without calling ahead, because you don't want to expose others to the virus. There's not a lot you can do to treat measles other than try to make your child more comfortable. These tips might help your little one feel better. And remember to keep your child away from others so she doesn't spread the illness. Make sure she gets plenty of rest and fluids. Run a cool mist vaporizer to help with the cough. For fever and aches, give your child the proper dose of ibuprofen, if she's 6 months or older, or acetaminophen, if she's 3 months or older. If your child is younger than 3 months, check with a doctor before giving her any medication, even an over-the-counter pain reliever. Never give your child aspirin, it can trigger Reyes syndrome, a rare but potentially fatal disease. Note: once your child's healthcare provider confirms that your child has measles, the provider is required to report it to the state health department, which in turn reports it to the CDC, to track and prevent the spread of this contagious disease. Is there any way to prevent my child from catching measles? Yes. The MMR vaccine, which protects your child against measles, mumps, and rubella, is about 93% effective at preventing measles after 1 dose and 97% effective at preventing measles after the second dose. If your child has missed any scheduled immunizations, check with a doctor about an updated schedule. When should my child get the vaccine? The first dose of the MMR vaccine is routinely given between 12 and 15 months of age. Before your baby's first birthday, the antibodies he received from you at birth may interfere with his ability to initiate a strong reaction against the vaccine. In the meantime, he has some protection against measles from antibodies received from you in the womb. The second dose of the vaccine is usually given when your child is between 4 and 6 years old. There are a couple of situations in which your child can receive the vaccine before his first birthday. If you're planning to travel overseas with your baby and he is 6 to 11 months old, his doctor will give him 1 dose of the MMR vaccine before leaving. If he's 12 months or older, she'll give him 2 doses of the vaccine, at least 28 days apart. The doctor may also give your baby a dose of the vaccine if there is a local outbreak and he's between 6 and 11 months old. If there's an outbreak in your area, your local and state health departments will provide recommendations, and your child's doctor can advise you on what to do. Is the measles vaccine a live vaccine? The MMR vaccine is what's called a live attenuated vaccine, a live virus that's been weakened so that it won't cause the disease in your child. Instead, the virus will replicate in the cells of her body and cause her to produce an immune response, which should protect against infection when she meets up with a real measles virus. The vaccine is the best way to prevent this illness. Some children develop a mild rash and fever after the vaccine, but it's uncommon and only lasts a few days. That's all what we got for now. Comment below and let us know about your baby. Hit that like button to help us reach more audience to spread this knowledge. So see you later. Bye for now.